huge problem. And that is why the vaccine reluctance is going to be a bigger problem for us than we realize. People are no longer afraid of COVID-19. Therefore, they are less willing to take protection against it. So I want to thank everyone here because I know just what you're going through. Sometimes it is not even telling the public. It is even telling our own supervisors how bad things are. Because first, you don't want to scare them. And secondly, at the same time, some of the issues are so complicated that it's not for you to confuse them. And so we must continue to speak up. I'm here to explain why we must pay for the vaccination of people we don't know and will never meet. In this room. I'm here to explain why, even though the federal government of Nigeria has all the complications and financial difficulties that has come on the back of the economic downturn, it must still find the money to ensure that we are all vaccinated. I'm here to explain why even states that are borrowing money must still find a wherewithal to borrow money for vaccination. But most importantly, we as private sectors, companies that have struggled in the last year because of the economic downturn must still dig into our profit and sometimes into our capital to support the vaccination of the public, to pay for the vaccination of our employees. But there is also a part of it that is not so obvious. There are people in this room for whom the value of a vaccination is not 10,000 naira or 50,000 naira, it's not 500,000 naira, maybe 5 million. That is the benefit they get, or that they stand to lose if the society does not function properly. The good example is someone who is a very successful comedian. If he misses out one event for which he would have been paid 1 million naira, the cost of a vaccination to him is not 50,000 that he would have paid. It's 1 million naira that he has lost, and that he will continue to lose for as long as the society is shut down. So let us not think of vaccination as a $20 event. Let us think of it about the economic, the value that we stand to lose. And the more value you stand to lose, the more you must be willing to pay. Because it is not enough for you to be vaccinated. It is only useful when everyone else has been vaccinated and the economy can function. So the reason we want to pay, the reason we must pay is not because we are suddenly very good people looking to go to heaven. It is because everything that is valuable to us, will amount to naught if we don't get this society vaccinated and vaccinated very quickly. The people who run this facility, this place is going to be back to empty by the time we get to the next event. This place will be empty, and whatever it is that they are earning today, they will be very happy to have paid half of it so that their people can be vaccinated, so that when they reach out to Sterling to say, come and host an event, they tell me that their people have been vaccinated and therefore it's safe to come here. That is the simple economics of vaccination. Those for whom the benefit of reopening the economy is so significant must pay for those who cannot afford to be vaccinated. And the money that the government must put up, where they must put up money, is not for vaccination per se, even though that is what they are buying. It is to ensure that the economy does not go back into a lockdown that will create massive, massive unemployment, that will then create social crisis, that will then create security problem, that then suddenly we are able to find 1 or 2 billion where we couldn't find $100 million for vaccination because we did not do the vaccination. So for me as an individual, I am willing to take the pain. For Sterling Bank as a corporate, we have taken tremendous amount of pain for a company our size. We have participated in every single part of the process of fighting COVID-19 that is relevant. We've participated in activating the testing centers, some of the first experiment in testing we did with Biobank. We have actively participated in creating isolation centers. Of course, we contributed to COVID, but most importantly, and what I'm proudest of, is that we set up a fund to support the healthcare workers, because we realized that those people were ignored in our pursuit to solve for infrastructure. Nobody thought about the individuals who could not afford to take care of their families at home because they're locked down in isolation centers. And we put up a fund that successfully raised well over 60 million and paid out hazard allowance to healthcare workers. And we think that we need to go back there again, because those healthcare workers, the demand on them is only going to become more. And finally, and I think this is to thank all of the people in this room, I know that our government, they raise their game. People don't understand, for instance, that even the NCDC did not exist in the form it existed today until, what, 2018? Such a timely action by the government, and what everyone else has done. But the people that I want to finally acknowledge are all the small companies and the not so small companies that have used technology, used their various investments that they've made trying to build private companies to support this public process. And luckily for me, a lot of them are actually on the board here. And for me, it's been a thing of pride to have been their partner. So for every single person that has rededicated their private resources towards solving this public health crisis, thank you very much, and you're all welcome.
Thank you very much. I hear your colleagues at work shorting Abubakar to Abu. So they said, Abu has been around since, but he's in the boardroom. Did anybody notice anything in terms of timing of the last speaker's presentation? So you see people who calculate their seconds in dollars. Anything extra